Adolescence, in every culture, is that unique period in life when an individual is in the middle of the tumultuous transition from the dependence of childhood to the independence of adulthood. Included in that transition is dealing with becoming a mature sexual being with all of its risks, rewards, and responsibilities. This part of adolescence has been problematic in our country because many people are uncomfortable talking about sex. That discomfort is one of the reasons why the United States has the highest teen pregnancy rate in the developed world. But progress is being made in that area. Since 1990, we've seen a dramatic reduction in teen pregnancy rates across the country. That reduction has been particularly evident in Minnesota, where the rates of teen pregnancy have dropped by 50 to 75% in all racial and ethnic groups. That reduction didn't happen by accident. It is a result of major efforts to help teens deal with the challenges of becoming a mature, responsible sexual adult. We'll talk about some of those efforts on today's episode of A Public Health Journal. Please stay tuned.
Welcome to A Public Health Journal, a program that explores the public health issues facing our society today and tomorrow. The host of our show is Dr. Ed Ehlinger, Commissioner of Health for the state of Minnesota. A Public Health Journal is sponsored by the Minnesota Department of Health, the Hennepin County Human Services and Public Health Department, and the Minnesota Public Health Association, all working together towards the goal of healthy people living and thriving in healthy communities.
Welcome to A Public Health Journal. Today we're going to look at some of the health issues facing adolescents in our state. Because many of the health issues of adolescents revolve around sexual health, we'll be particularly focusing on how adolescents can successfully transition into becoming mature and responsible sexual beings. However, before we get to that conversation with my guests, we'll set the stage with a video from the National Campaign to Prevent Teen and Unplanned Pregnancy entitled Too Young. This video highlights how an unplanned pregnancy can disrupt the lives of a teenager and have significant lifelong impacts. So let's watch this video.
My mom had no idea I was having sex. I didn't communicate with her at all about it. And so the first she knew of me having sex was when I told her I was pregnant.
I was 17 when I had my daughter and 19 when I had my son.
I was 16 when I had my daughter. I was only 15.
I was 16 when I got pregnant.
I was so scared. I was devastated. I had no idea how I became pregnant. I was an honor student. I was a good kid.
It was like my senior year of high school, so it's like I missed out on a lot, like prom and graduation.
I missed out on graduating with my class. You know, I didn't want to be that kid left out.
I went into the hospital for a regular checkup, and I had about 2 weeks left to go, and they gave me an ultrasound, and my son only registered as 35 weeks, even though I was 37 weeks along, so that meant that for 2 weeks he hadn't grown at all.
She had a lot of problems with growing. She was in the less than 5th percentile.
You don't really want to like live off the government or whatever, but it's just like part of the consequences when you make the decision at a young age to have a child. You just have to take whatever you get and try to work with it.
No matter how careful you are with your food, money, you still wind up running out.
It's definitely like I'm not even sure how we make it.
It's real hard. Can't bring the money in. Can't pay the rent in time. Can't buy my baby clothes that I need to really buy her.
First person I told was my boyfriend, and he said that everything was going to be fine. He said that it would be great. He'd get a job, and we'd get an apartment, and everything would be fine.
He was around until he was like 2-3 months old.
Me and him are no longer together.
And he's not involved in her life at all.
I was 15 years old with this new baby, and I'm all by myself.
Almost everybody that I know from junior high and high school wound up being teen parents.
Good kids can make bad choices, just like everybody else.
Welcome back. Joining me now is Gabriel McNeal, the Adolescent and Youth Development Specialist at the Minnesota Department of Health. In that role, Gabriel manages the Minnesota Personal Responsibility Education Program. Also joining me is Sara Hollie, the Healthy Youth Development Coordinator at the Minnesota Department of Health. Among other things, Sara manages the Abstinence Education Program that supports Minnesota's Healthy Teen Initiative. Both of these initiatives focus on populations experiencing the greatest disparities in teen pregnancies and sexually transmitted infections through the implementation of high-quality, medically accurate, evidence-based, and informed programs. Gabriel and Sara, welcome to the program.
Thank you.
So after that sort of sobering video, I want to start by asking you, what's your impression? What's the takeaway from that video that our audience should take away? Gabriel, what about you?
The first thing I thought of was teen pregnancy affects us all. On the video, it didn't talk about, the socioeconomic backgrounds of these, I'll say, young ladies that were filmed. So it affects us all. It doesn't matter what economic background, and actually as far as the races and culture, doesn't matter what color. It has no face to that. Yeah,
it was evident that every race and color was there and is experienced. It is a problem.
Every background, every age, if you're a sexual being.
Yeah,
yes.
And we'll have a little slide that points that out a little bit. Sara, what was the takeaway from you?
I think the takeaway for me is the fact that you have teens talking about what they're going through, and the fact that awareness is so important in the impact of teen pregnancy. And I think the programs that we'll talk about today too, the importance of them and reaching our young people early on and educating them about, the impact of pregnancy. So I think the young people on the video giving their stories, I think is the most impactful thing that we can do for our young people these days, is really share stories and experiences so that the cycle's not repeated.
Mm-hmm. Now, this was done by a national organization, but is unplanned pregnancy, teen pregnancy, a problem in Minnesota? Gabriel?
Oh, absolutely. Most pregnancies here in the state and nationally are unplanned, and that is reflective in the video. So it's a lot of the consequences they talked about. Planned pregnancies at any age is going to, have better outcomes than what the young ladies talked about in their stories.
Right. And Sara, what are you seeing as some of those outcomes that we really want to prevent happening in Minnesota?
Well, definitely. So, if you're pregnant or you get pregnant at a young age, some of the outcomes can be, lack of employment, housing, things that our young people really don't need to face at a young age. And so we're seeing our teen pregnancy rates really being high based on geography, race, and ethnicity. In certain areas, we have, kids that are aging out of foster care that are faced with pregnancies. And so we just want to make sure that the supports are around our young people so that they're they're not impacted by a pregnancy, as Gabriel mentioned, unplanned pregnancy. So we want to do everything we can to raise awareness and prevent those pregnancies at a young age.
Yeah, and I mean, it sounds kind of depressing, but we have a slide here that shows we're actually making some progress. As I mentioned in my introduction, we've really reduced teen pregnancy rates dramatically. And so tell us what's going on with this slide that you can see on the screen that really shows, with the various racial and ethnic groups, from 2000 to 2015, really making some progress. Kind of walk us through this.
So what we're seeing here is that based on race and ethnicity and American Indian communities, we see a decline over the last, I want to say, maybe 10 to 20 years, really. And we don't see the 90s in this slide, but we had a huge hike at that point, and then a huge decrease. And so right now what we're seeing is you'll see based on race and ethnicity that we have a huge decline, like the commissioner just mentioned, in teen pregnancies and also in teen births. And so that slide isn't there, but we're seeing that decline. But we also see that there's kind of an imbalance based on race and ethnicity of teen pregnancies. So we have our communities of color and American Indian communities that do have higher rates than our Caucasian and white teens. And so the programs that we're leading in Minnesota are really trying to address those disparities and equities based on what we're seeing.
So something positive must be going on to have these kinds of, what has been the impetus behind these marked drops? Gabriel, what do you see?
Well, I've been with the state for 21 years, and Minnesota, in the state of Minnesota, Sara's overseeing the Abstinence Education Program. Actually, in 1995 is when the state funding was allocated for abstinence education here in the state of Minnesota. So we've made huge strides in trying to address these issues, particularly with the ethnicity and races that we're seeing the highest rates. And so the program began in 1996 and is still continued today. So that's, I think, very important as far as one of them. And then I'll talk later about the program that I oversee now that's been happening for the past 4.5 to 5 years. That's, delves more into the comprehensive sex piece and reaching some of the foster care, homeless youth, youth coming out of the juvenile detention centers. Some of the, I won't say more at risk, more riskier behaviors, and so it takes a different approach to address those.
Well, let's get into those programs. Sarah, both you and Gabriel are really working on teen pregnancy prevention, taking a little different approach. So tell us what you're doing collectively and sort of what programs you're each involved with and separately. So
Sure. So I manage a federally funded program called the Abstinence Education Program, and it funds the Healthy Teen Initiative at the State Health Department. My program specifically focuses on really targeting our efforts to our middle school youth to delay the onset of sexual activity, really abstinence focused, but to also have those wraparound services around healthy youth development. So Minnesota is doing some really creative things with our funding to make sure that we're taking a healthy youth development approach with our abstinence ed funding. And so we not only target our 10 to 14-year-olds statewide, but we also target our parents of teens that are 10 to 19 years old. So it's really fabulous that we have programming that can reach parents of teens in order to really arm them with the resources and information to really be the primary sexuality educators for their young people. And so we're finding great outcomes in that and support. And so along with Gabriel, this is actually kind of a sister program where the Personal Responsibility Education Program and the AB Ed program are really working together to really address teen pregnancy rates, but also to decrease sexually transmitted infection rates in the state of Minnesota. So we're very fortunate to have that federal funding.
Now, obviously, at a young age, abstinence is the most effective way of preventing pregnancy. But we know that from the Minnesota Student Survey, a lot of students are having sex.
They are.
And so is this abstinence education part of a more comprehensive approach to reproductive health?
Most definitely. And so I would say the AB Ed piece is the reason why we chose that age group, again, commissioners, because it's a younger age group to delay that onset. But we actually have programming that is being utilized not only by Gabriel's program, but by other programs in the state, like the Teen Outreach Program, which is really a youth development program that really addresses teen pregnancy. It really addresses high school dropout rates, suspensions, making sure our young people stay in school and really have the supports they need. So the programming that we're using through the AB Ed money not only is to reduce teen pregnancies at a young age, and to delay the onset of sexual activity, but to really have those supports around our young people and programming that meets the needs of our young people.
And Gabriel, tell us about your program, the Minnesota Personal Responsibility Education Program, and how that works in collaboration with what Sara's doing.
Okay, the program that I oversee is federally funded, and it's specifically addressing or discussing comprehensive sex for foster care youth, youth at juvenile detention centers are transitioning out, homeless youth, all the youth of color, American Indian youth, LGBTQ youth. Those are the target populations.
And these are populations that are at the highest risk.
At the highest risk, and nationally, across the state, we know that when we attend all the national conferences, we, discuss and, talk together about what's happening in each of the states. But it is the ones with the highest rates. There are 6 to 8 curriculums that are offered here in the state, and most of the sites that have been funded over the past 4.5, 5 years, the majority were clinics, right out of the clinic setting. So when people come in, first encouraging them to come get services for whatever they may need with teen pregnancy awareness or STI prevention. The curriculum is offered right on site when they're attempting to get other resources. So say, for example, if they're there at a clinic and they find out they're facing issues or concerned about a pregnancy or ways to prevent having a pregnancy, they'll refer them to a health educator or a community health educator to give them more information and arm them with, how to really equip themselves with preventing. So majority are clinics. We have had an alternative school that was funded, and also addressing in our American Indian community, which has some of the highest rates in one of the rural areas.
Now, I know that your programs are really based on best practices, and I want to, when we come back after a little break, I want to talk about what's working and how do we implement this, what's working, and what else we need to do, and who needs to be partners with us in this really society-wide issue that we're going to deal with. So we'll be back right after this message. Good job.
Don't ignore the subtext. It's on us to intervene in sexual assault. Because we can. Take the pledge at itsonus.org.
Well, welcome back. We're talking about the prevention of unplanned pregnancies, particularly among teens, with Sara Hollie and Gabriel McNeal from the Minnesota Department of Health. So the programs that you have, I said, are the evidence-based, best practices. What are we finding collectively, not just in your programs, but really dealing with the whole issue of teen pregnancy? What's working? What are the things that we find really help to reduce unplanned pregnancy, reduce teen pregnancy among all groups? Gabriel?
I think working together in a community, really finding out what the community need is, finding out what students and what populations are in your community. Even though the rates are high, there may be a community with more, I'll just say, already firstborn. And so in that community, you may want to, we would guide them as a state professional with finding a curriculum that deals with, maybe trying to bring awareness around preventing a second pregnancy if that's something that's not wanted in the community. So we really encourage people to look at the need in their particular community, who they're trying to serve, be it a school district, one of the school-based clinics, one of our community clinics, and then partner work together because as we know, youth do and families transition from one community to another, from one state to another. So really trying to find out what the needs are in the community, finding the best fit for that evidence-based curriculum, and then all the partners working together and not in silos.
Now, Sara, as I mentioned earlier on, the United States is markedly different, an outlier from the rest of the country, rest of the world in terms of developed countries. What are other countries doing that we're not? Why is our teen pregnancy rate so high compared to those other developed countries?
Most definitely. So I think what other countries are doing first and foremost is they have, they talk about sex openly and have ComSex Ed programs that really address what teens are talking about and doing, and they're not ignoring, not to say that the U.S. is necessarily ignoring, but they're not ignoring the fact that teens are having sex, right? And so, and eventually will have sex. And so, you know, having that, the reproductive health system really focused on arming their teens with resources, whether it be condoms, whether it be clinical services that have programming. And I also think just having open and honest conversations about the issue of pregnancy, sexually transmitted infections, but also maybe even providing more resources and support for our teens beyond the issue of sex, right? So employment, housing, making sure that, you know, if you are a teen parent, that you feel supported. I think the video really hinted on that, the social isolation that happens when you do become a teen parent, or could happen because you may be the only teen in your school that's had a baby. So I think that may be the difference between the U.S. And other countries.
Yeah. And as we saw, the rates are getting better in the United States. Does that mean we're more openly talking about sex and sexuality?
I think there are, I think we're a little better at that. I won't say we've, you know, arrived or made it, but I will say that in general, I lost my thought.
Yeah. Are we getting, you know, are we getting better in talking about sex? And,
oh yes, we somewhat we are with Sarah's program, having things targeted right to bring awareness and arming parents with the right conversations they need to have. We just had a campaign at the department with in relation to October Let's Talk months. So we are having more open conversations. There are curriculums for parents in the communities. And just having open conversations with a lot of the youth and encouraging them to have supports, even if it's not a parent, a guardian, be a counselor, whoever that support may be, helping them to know how to go and ask the questions to get the resources that they need, I think is important.
Yeah, and we're an increasingly diverse state, so is it different with different cultures and different racial groups? Do you have to have different approaches to the conversation, different? Do you have to have different stories?
You do, most definitely, and I think our programs are doing that. One of my grantees, Division of Indian Work, is really working with the tribal communities on with a curriculum that is really for that community. And so the great thing about, I think, our programs is that we're identifying not just evidence-based curriculums, but evidence-informed curriculums that the communities have developed. We have another curriculum called Encuentro, which works with the Latino community and their families at the same time. And so making sure that we have approaches in our state that really meet the needs of our communities of all races, backgrounds, and not just based on race, right? Gabriel's program works with young people in juvenile detention, or our lesbian, gay, transgender, and queer youth. We have to have programs that meet the needs of our youth. And that's not always the case, Commissioner. And so we have to find ways that we can really support our educators and our facilitators that are going into the schools and community centers and communities to educate our young people and their parents about the importance of sex ed and delaying the onset of sexual activity.
Well, you talked about parents, and you actually talked earlier about social supports. I mean, a lot of other people need to be involved. How are you engaging parents? How are you engaging other caregivers? How are you engaging the adults in the world? How are you engaging other sectors that have to be engaged? You know, because that seems to be really important. If we're going to take a more comprehensive view and a holistic view, we need to do that. So Sarah, how are you trying to do that?
So with the Healthy Teen Initiative, I mentioned earlier that we have this component for really adult mentors and parents. And so we're actually having community members be trained in certain, if you want to say, curricula or programming, where they can go out and talk to people in their community. And so we have a variety of parent ed programs that actually work directly with parents, caregivers, and guardians in the communities that where people are living. And so, like, for instance, in St. Paul Ramsey County, where we have high teen pregnancy rates, we actually have a parent ed program at Neighborhood House where we actually have parent educators that are going out to their respective communities and providing information and resources, answering those tough questions, not just about sex, but about things that relate to our young people. And so, like Gabriel mentioned, just starting those conversations and making sure you have accurate information that's factual to give to your young person, and starting those conversations early and not just having that sex talk, right, when it's time, but really starting those conversations across the life course. So if you have a 3-year-old, talk about, you know, good touch, bad touch, or, you know, how to cover your private parts. So those things are important, not just in our teenage years, but across the life course. And so MDH is just kind of ramping up a campaign called Make a Date. And so we encourage parents, caregivers, grandparents, whoever, caring adults to really start those conversations with their young people and children about particularly about sex, sexuality, and healthy relationships. And so they could submit stories to the health department and receive an age-appropriate book to kind of help guide that conversation and give parents resources and support. Because I think that's the biggest barrier, is that parents feel like, well, where do I go get this information, right? To arm me to have this conversation with my young people and my children.
I know when I was, in pediatric practice and I would see a teen mom, it was very obvious that that teen mom's mother was also had a teen birth, and also probably the grandmother had a teen birth. So there's sort of family history, there's multiple generations. How do you deal with the fact that you have to educate actually the grandparents and maybe even the great-grandparents about a change in how we view pregnancy, sexuality? And I think with the really high-risk populations that you're dealing with, Gabriel, there must be the same kind of multi-generational impact.
Absolutely. Along with the evidence-based curriculum, there's something nationally, the evidence-informed is also acceptable. So it's exactly what you're saying. We want to meet communities and individuals where they are. So we want to delve deeper and to go and have more conversations and find out what those stories are, to find out where the real need is, to find out where that prevention piece needs to happen, because like you said, it was the young teenager, their mother, and then their mother. It doesn't have to even go into the next generation. There can be a stopping point. And so a lot of at the federal level and also here in our state, we are looking into that to really address the awareness piece around the repeat pregnancies, the generational pregnancy piece. So it's something that has come a long way, and so there are a lot of decreases in that area, and it's something that we're not ignoring and we are thinking about.
Well, we've come to the end. We still have a lot more to talk about, but we don't have enough time. So thank you for the work that you're doing. Obviously, from the graph that we saw, we're making progress, still a long way to go. So keep up the good work, and I hope this message gets out to folks that everybody needs to be involved in reducing unplanned pregnancies, particularly among teens. So thanks for being with us.
Thank you.
And I'll be back with a closing comment right after this message.
I see the future is really bright for me. The high school diploma is just added to the confidence, and now I feel unstoppable.
Find free adult education classes near you at finishyourdiploma.org.
Author Wendell Berry wrote that a bad solution solves for a single purpose or goal, and in doing so often creates bigger problems in the larger society. Good solutions, he claims, recognize that they are part of a larger whole. They solve for more than one problem and don't create new problems. Attempts to reduce adolescent pregnancy rates often fall into the bad solution category because they only focus on one aspect of adolescent life, and in doing so often lead to a skewed picture of adolescence, one that highlights only the negative outcomes like poverty, lack of education, and poor health. We need to step back and take a broader view of adolescent life, one that shows us the complexity of their lives and how all parts of their world interconnect. This view will also give us a better insight into their dreams and hopes for the future. A broader contextual perspective will quickly show us that adolescence isn't just a period of life that we all have to suffer through. Rather, it'll show us that this is a critical and exciting time of maturation, growth, learning, and development that is preparing adolescents for their future adult roles in our society. That broader contextual perspective will probably also give us better insights to how to more comprehensively address some of the individual problems, like pregnancy and sexually transmitted infections, that adolescents face. So let's not just focus on the problems of adolescence. Let's focus on adolescents as a whole being who are in an integral and important part of our larger society. In doing that, we will have a better chance of discovering some of the good solutions that Wendell Berry writes about. That's all for today. Thanks for watching. I hope you can join us again next time on A Public Health Journal.